A conversation with author and long-term care expert Jennifer FitzPatrick. We're going to talk about what folks who are looking for long-term care for a loved one should consider, and also about the difficulty within the long-term care industry in keeping staffing levels at appropriate levels and providing quality care. Jennifer FitzPatrick, welcome to KGNU.
Thanks, Sam.
Let me start with a scenario that we're dealing with in my own family, and I'll get you to react to it. Without going into too much personal detail, an elderly relative who lost consciousness, had a fainting spell, was taken to the hospital, and eventually, after a few days, was moved to an assisted living facility, a nursing home, where they were to help her kind of regain some of her faculties and begin walking again, etc. Many of the things that were promised did not happen. The facility seemed very understaffed, and she got COVID. This is a person in their mid-80s, and so now one of her adult children is working to figure out a way to bring her to his home and get some in-home care so that she can get, more attentive care and better food, etc. So that's actually happening in my family right now. Is that a common scenario?
Oh my goodness, yes. Right now, it's so tough in any kind of healthcare, it's impossible for the communities and the facilities, and it's impossible for the patients and the families. For one, the rules keep changing with all the restrictions and all the visiting and all of the testing. So it's very, very difficult for senior living and nursing homes to keep people, for one. And the other piece of it, Sam, that I hear is the frustration for the family, and they're upset that the loved one got COVID. I mean, you can take all the precautions in the world, but COVID's a respiratory virus that is, especially this new variant, easily transmissible. So it's just a very stressful and upsetting time.
So what do you generally advise if you're talking to someone who has this scenario of a loved one in a nursing home, and maybe they, unlike within my family, they don't have the ability to move that loved one back home or into their home and get, in-home care? What do they do?
So I guess the first thing is to look at, do you have a budget? So are you relying strictly, it really does, Sam, it comes down to money. Does the family or the individual who needs care have private pay funds? Do they have any budget, income, assets, pension, what have you? And the reason that I think that's the most important place to start is that is when you start to figure out what your choices are. And so if someone had a budget in this situation, I would say to them, maybe speak to a care manager, a private care manager, usually a social worker or a nurse. And that's going to be a person that guides you to figure out what is best for your loved one in these circumstances. And it might be, okay, they still have a Medicare benefit. They can maybe looking for a different nursing home where they can do their rehab. Maybe it's about looking into, should this person move to an assisted living if the family or the individual's budget can support something like that, and then helping them figure out. Maybe it's about looking after the person gets through that rehab period of doing adult day. And that is that's a cost-effective option that sometimes takes Medicaid, but sometimes is a private pay option. If the person does not have a budget, so I would say, even if you only want to spend a little bit of money to talk to a care manager, and you can go to aginglifecare.org or caremanager.org to find somebody like that. Maybe even if you just do a 1 or 2 hour consult with that person. If you don't have a budget, I think call your area agency on aging. And if you go to N as in Nancy, the number 4A.org, N4A.org, and you're not going to get you're going to get help, but you're not paying for it privately. This is something that the government provides, but they are sort of a clearinghouse for services and answering questions when you have an older person that you're trying to help out. And the only drawback for that, I think it's great if you do have a budget or if you don't have a budget, but the only drawback for that is, they might not have hours on end to talk to you. If you're paying for a care manager, you're their client, they're going to make an appointment with you, they're going to give you as much time as you pay for.
And thanks, that's helpful. And what about folks who simply don't have any resources? That is, they would then be eligible for Medicaid, I assume, the federal state program of health care for folks who are very low income. Is that correct?
So, Sam, it depends. Excuse me. If somebody so what I would recommend, and I'm not sure if this family member of yours is still in the nursing home, but I would talk to the social worker at the nursing home or the social services designee and say, look, we don't really want our loved one to remain here. We're not really happy. Tell them what your concerns are. And I'm sure that you're not the only one. That if you're telling me that this place is short-staffed, which sadly, frankly, most places in healthcare are right now for a variety of reasons. And just say, look, this is what's going on. What do you recommend? What is my mom or my husband, whoever the person is, what are they eligible for? What are their services? Because a lot of times when somebody's in a nursing home for rehab, they're there, and that is probably a good choice for a lot of people. But if they're really unhappy, they don't like it, a lot of times those Medicare benefits can be utilized at home. Now, the downside of that, if they need physical therapy or occupational therapy or speech therapy, is they're not 24 hours in a place where they're able to practice, right? Do you get what I'm saying? Like, Sam, like in a facility like a nursing home, they have the setup where they can practice some of those skills. When it's in a private home, there's less supervision, obviously, especially if you're not hiring help. But you can a lot of times get that Medicare benefit to go home with you, and maybe they're sending out the physical therapist or the occupational therapist or whoever the services that you're eligible for out a certain amount of times per week. So I think just really communicate. The other piece of it, if you're ever displeased with a nursing home or an assisted living, you can always call the ombudsman. And that person is typically found at the Area Agency on Aging as well. But if the nursing home or the assisted living always should have signs up that say who the ombudsman is, what the phone number is. And then also you can always just ask anybody in that building, hey, I really want to talk to the ombudsman. The ombudsman's job is really to be a liaison between the patient and the family and the facility or the community if there's issues, and try to help broker understanding and broker so both parties are able to work together.
And I know your specialty is working with patients and their loved ones, but turning to the side of the nursing home or the facility, we may be frustrated not due to any mistakes or lack of professionalism on the part of the staff of the facility. It just may be, as we've been talking about, that they're just understaffed for reasons of COVID, of low pay, et cetera. What do you see as someone who studies the industry as potential solutions to that side of the problem?
Sam, this has been a perfect storm. This has been going on for I've been working in this field since I was 16. I'm 48 now. And this is a perfect storm of, there's never been, frankly, enough people that want to work with older adults. There's never been enough pay. It's an area, like most people, when they get into, say, any area of healthcare, what do they say? Oh, I want to work with kids. I want to work with younger people. I feel like we have done so much in the field trying to encourage people to specialize in geriatrics, specialize in gerontology, trying to do programs like, recruiting nurses, for example, from other countries, creating programs where nursing assistants can go to nursing school if they work for certain companies for a period of time. But I think that we've really created a mess, frankly, right now, that because I think of a lot of these government rules, and they keep changing them about vaccines, about masks, about testing, about quarantine, a lot of people are just saying, you know what, the heck with it. I'm going to go work, let's say you're working as a nursing assistant. You can go work at a fast food establishment sometimes and make more money and get better benefits, or work at a grocery store or work. So I think that having these very strict rules, this is one of the most heavily regulated industries in our country. I think what we need to do is, and the reimbursements are low for when somebody does get Medicaid in a nursing home. So I think that, and by the way, one of the other problems is that a lot of times the senior livings, with all of the handouts that the government gave out during all this COVID mess, they were overlooked. They did not get very much compared to other industries. So listen, I don't want to be one of those people. I'm an independent, so I'm not a Republican. I'm not a Democrat. But that said, I will tell you that I do think that the senior living and nursing homes did not get enough money as compared to other industries. And I think we're suffering because of that. So I think that we need to make it a priority. We need to make, and again, I'm not suggesting that we need to give, I don't know what the answer in terms of like government subsidies and all that means. But I do think we need to increase reimbursements to the places that do take Medicaid. It's very hard to find a Medicaid bed under normal circumstances in a good, clean, nice community. But I think that senior living and nursing homes have to be really creative with what they're going to offer to people in terms of benefits. They have to be competitive. They're not just competing with a nursing home or an assisted living in a different town or down the street. They're competing with all the other jobs out there. I mean, nurses are leaving healthcare in droves. We had a nursing shortage before COVID. So I think it's just a matter of looking at, hey, how do we address the burnout? How do we make sure that we're paying more than a competitive wage? Because people have been underpaid in those fields for so long. And really listening to the employees. One of the problems, Sam, that I see right now is people, I'm a speaker and an educator, and I teach gerontology at Johns Hopkins. One of the things that I hear over and over again right now, people are like, I can't take a day off. And of course, one of the worst things about burnout is when people work too many hours. If I take a day off, they're calling me. They won't leave me alone. If I ask for a week off, they kind of give me a hard time. And so people are like, you know what? I don't need this. I'm going to quit.
So I hear you about the funding shortfall. I want to make sure that to clarify one point you made at the start of your response about regulations regarding COVID. I mean, we're dealing with the most vulnerable population in terms of a potential fatality from the disease. Are you advocating for different regulations there, or what?
In terms, I think so. Okay, so if I were in charge of all the regulations, I think I would have done a lot of, all of this differently. I don't think I would have shut down the economy. I think I would have given a lot of subsidies to senior living and nursing homes. I think that protecting the vulnerable, in my opinion, is really what this whole thing should have been about. We know that, like you just said, Sam, mortality and adverse outcomes are most likely when someone is elderly and they have multiple comorbidities. Well, where do those people live? They live in nursing homes. So, why did we put all of these? Of course, certainly there's outliers, and of course there's a 40-year-old person that has, been impacted awfully or had a terrible outcome. But for the most part, we spread all of those monies and the subsidies and everything, giving unemployment and all those unemployment packages. We gave them to all of these other people that were much less at risk than nursing homes and senior living communities. So, I know that I'm being a Monday morning quarterback, but I'm a big fan of the Great Barrington Declaration. I don't know if you've read it. But it's several doctors in the beginning of the pandemic that was their philosophy. Like, let's keep the elderly safe. Let's keep those with lots of comorbidities safe. And I think we failed at that.
We're talking with Jennifer FitzPatrick. She's the author of Cruising Through Caregiving, Reducing the Stress of Caring for Your Loved One. If you have a loved one who may be in need of long-term care, would you recommend not putting the loved one there right now? If you can at all avoid it?
No. It's really a wonderful question. I think you have to make a risk-benefit analysis. So I will never say don't place your loved one. Sometimes you absolutely need to, because maybe you just don't, maybe you're 80 yourself and your husband has all these, it's laborious to take care of your husband, help him out in the bathroom, take him, give him a shower. What I would say is really think hard about what your non-negotiables are. Like, what do you need from a community? And I think, and I have a whole chapter in Cruising Through Caregiving about that. What are your non-negotiables? But I would say get guidance. And one group that I really like, especially if you don't have a budget, is a group called Oasis Senior Advisors. And they're a group, they're an organization that are all over the country, and they do not take money from the client, so a family member, but they'll help you find a place for your loved one. They charge the facility or the community a fee. And this is when you're in a private pay situation. Then the other piece of it, I would say, is if you do have a budget, and Oasis is there for people who have a budget or don't have a budget, but also you could, like I said earlier, hire an aging life care manager, aginglifecare.org, a private nurse or social worker to help you navigate. And the reason that I suggest using a care manager or an Oasis, that type of program, so just to clarify, the Oasis is totally free to the family and the patient, and the care manager would be private pay. The reason that I suggest that, because right now they have their fingers on the pulse of what's happening in all of the communities. When you're just going in cold as a family member who, oh my goodness, my loved one is sick and I don't know the first thing about looking, well, they can provide guidance and they can help you. So I think more than ever, using a service like that can really be beneficial.
If instead of a facility you want to care for your loved one at home, what do you advise people to keep top of mind?
Okay, so one, go to a licensed, bonded agency. Do not hire your neighbor. Okay, and I say that, and people say, why not? I know my neighbor, they're great. This person is very reliable. Okay, here's why you don't want to do that. Number one, or you don't want to, listen, sometimes it can work out beautifully. You hire your neighbor. You hire your friend's granddaughter. Sometimes it's great. But so often it doesn't work out, and here's why. Number one, often they don't have training. Number two, it can really put a lot of stress on the relationship. So if it's your friend's granddaughter, she's taking care of your husband now, and something doesn't go well, that can interrupt your friendship. You live next door to the neighbor, they didn't show up one day, and now you're having a bad relationship with your neighbor. But again, and the people also will just place ads like on Craigslist or on Facebook or something like that. And I think that's a terrible idea. I can't even tell you how many people I know who have hired criminals who have come into their home and ripped them off. So it's a little more expensive to go through a private agency, but go through a reputable agency in your community that's licensed, that's bonded, that trains their employees. And again, if you don't know where to start, one would be your area agency on aging. Call them, and again, n4a.org. You can plug in your zip code, and it'll tell you who to call. And this is run by the government. And just say, look, this is where I live. I live in Boulder. I'm looking for reputable home care agencies. Meet with the people that they're going to send into your home. They're going to initially send out probably a sales marketing person, maybe a nurse, but that's not going to be the person that is in your home. Ask to meet the actual people that will come into your home. The other great thing, instead of hiring a neighbor, instead of hiring your friend's granddaughter, is when you work with a reputable agency, what if your home care aide gets COVID? Well, or the flu. I mean, there are other things besides COVID that people get. They have strep throat, whatever. You have a substitute, right? That there's going to be somebody there, and it's not going to be perfect. That person might be, if you find out your aide is sick today, and it might be a couple hours till they can find somebody to replace them, but you have a better shot at getting somebody to come rather than if your neighbor's like, oh no, I have the flu today, I can't come over.
So you've cautioned us against hiring neighbors or members of the family, but what if that's really one of your few available options? How do you put together a team of friends and family?
Awesome. So in Cruising Through Caregiving, I have several exercises. If you go to cruisingthroughcaregiving.com, you can download 6 exercises plus a free chapter. And one of the exercises is the MET exercise, and it's how to assemble what I call a caregiving crew. And it helps you to figure out people in your friend, family, neighbor, faith community network that can be there for you. And you might say, oh, Jen, you just said don't hire your neighbor to be a home care aide. Right. Don't hire the neighbor to be a home care aide. But right now, I'm going to just give you an example. I have a neighbor whose husband just suffered a stroke. We've been bringing meals over. That's what I mean about being part of a caregiving crew. She didn't hire me to be an aide for her husband, but there are things that I can do willingly for free, like bring meals, run errands. I run to the grocery store for her, for example. So this MET exercise helps you to find out people and identify people that you wouldn't maybe necessarily think of in your friend, family, neighbor, faith community that will volunteer their time. Also, there are really great websites that you can assign tasks. Caring Bridge is one. Lots of Helping Hands is another. What I would say is be careful if you're making task assignments and you're sharing like, okay, we need somebody to stay with Bob while I run to go to my own doctor's appointment. Try to be organized and do it on sort of one of those calendars like you get like with Caring Bridge or Lots of Helping Hands or one of those. I see people trying to do this sometimes on public Facebook groups, and I don't think it's as efficient. Plus, I think it's sort of kind of hard because you don't really have the privacy because almost anybody can see it. So I just think be mindful of that. But definitely go to cruisingthroughcaregiving.com. You can download all those worksheets like the MET exercise.
And any final comment?
Just please know that there's not one way to be a good family caregiver. Whether you choose nursing home, assisted living, home care, getting family and friends together to do it together, adult daycare, just know that your loved one is very, very fortunate to have you, and please don't beat yourself up with guilt. Do the best that you can within reason. Take care of yourself.
Jennifer FitzPatrick is the author of Cruising Through Caregiving, Reducing the Stress of Caring for Your Loved One. That's also her website, cruisingthroughcaregiving.com. Thanks for speaking with us today.
Thanks, Sam.